Because myself is a hematopathologist, as I mentioned, so we now is very common even in the small community hospital run NGS and find mutations, but the problems with those gene panels, for example, in our hospitals around the panel of 140 or 145 mutated genes. But in terms of use those, this gives us tremendous pause. For some cases, has very subtle, like morphologic dysplasia. Those can help us to make a diagnosis in some cases. So that's why WHO and also ICC has new guideline incorporated into this so-called MDS with these mutations. We can help us, but the drawback from those mutation studies is that you can overdiagnose based on mutations because it's in its natural aging process. During the aging, those genes tended to mutate. According the people become especially elderly, so it's very common. So this downside of this is might be overdiagnosis, and the patient might be got overtreated for this, in my opinion. So in my clinic, and the patient come to us, well, quite frankly, quite often, patient already been diagnosed MDS just based on mutations, but we actually did not see MDS for sure in those patients. We have been also followed those patients for a long time without progression. So, in my opinion, those tests are very helpful, but need to be used very wisely. Put a lot of cautions into those clinical practice for using those tests.